Hello everyone and welcome to the 13th episode of Educhat with Dr. Sujit. I'm sure you're enjoying asking questions as much I'm enjoying answering them. And we get so many questions every week and it becomes sometimes challenging to select the top 3 questions. And even today I'm going to answer the top 3 questions that we received in the last week. And as you know, we select the best question every time, and the person who asks the best question gets a copy of my international bestseller book, New Age Dentalpreneur, absolutely free. So let's start with this 13th episode. And today, behind the camera, the voice of the question is Palak. So Palak is going to ask me the questions, and I'm actually excited to answer your questions this week. So Palak, what's the first question of the week?
Dr. Kalpana has asked how to improve effective communication skills.
Okay, so wonderful question. How to improve effective communication? How to become a very good communicator? Now, this reminds me of one of the quotes in one of Robert Kiyosaki's book. And he said that you need only 3 skills if you really want to become super successful in human life. And they are marketing, people management, and communication. Yes, communication skills are so important. And I always say this, that communication is the most important soft skill in the world. Because if you are an effective communicator, you can convey the message, you can convey the knowledge, you can convey the information very properly. If you are an effective communicator, you can engage people, you can attract people, you can lead people, you can teach people, you can guide people, you can mentor people. If you are an effective communicator, you can become a very successful dentist as well. Simply because in order to do a successful treatment, you need to do a very powerful patient consultation. And in order to do that powerful patient consultation, you need to have very good communication skills. Right? Now, when it comes to effective communication, there are 3 elements of effective communication. And they are the words you say. That means what you say. The second element is your voice modulation, how you say. The third element is your body language, what you say when you do not say anything. And it's always said that what you say, the words contributes to 7% of effective communication. Yes, only 7%. So people do not remember what you have said. What they remember is how you have said. Your voice modulation contributes to 38% of effective communication. And you know what contributes the highest? It's body language. Your body language contributes to 55%, more than half of effectiveness in the communication. So if you want to become a very effective communicator, you need to work on all these 3 things. Now, when I say that the words contributes to only 7%, does it mean that it doesn't matter what you say, but if you say it well and if your body language is good, that will be conveyed? And the answer is no. Even if the word contributes to 7%, it doesn't mean that words are less important than your voice modulation or your body language. In fact, I always say it in my courses that every single word, in every single sentence, in every single consultation can make or break your patient consultation. Every single word matters because it can enhance whatever you want to convey as a message, or it can confuse your patient, it can give the clarity, it can give them misunderstanding, it can give them proper understanding, whatever. So the words are important. Even if people do not remember what you have said, but they will get the message. That's why the words are important. You need to keep on enhancing on the effectiveness of the words and sentences you use whenever you are having any communication, especially in dental practice. Remember, in dentistry, patient consultation is a very important art. And it's a very important activity because no matter how good clinician you are, unless you have a patient who accepts your treatment plan, you cannot treat the patient. And dentistry, as I said so many times, is not a compulsive field. It's an elective science. And the moment it is elective, people can always postpone the treatment, give reasons to themselves as well as to a dentist for why they do not want to do it right now. And it is the effective communication skills, it is effective patient consultations which is going to help you in doing that patient, in gaining that patient, right? So the words are important. Now, when I say how you say is more important than the words, your voice modulation. So what are the important things in voice modulation? There are three elements in the voice modulation which are important. Number one is the pitch of your voice. Number two, the pauses you take when you talk. And number three, the emphasis you give on specific words or specific sentences. So you need to keep on working to enhance the proper proportion of your pitch, the pause when you take it, and when and how, and most importantly, how much to emphasize while doing that consultation. And most important thing where you need to work on is your body language. And the elements of body language which creates an impact are 5. Number one is the gestures. Whenever you are communicating, your hand movements and facial expressions are your gestures. Number two is your posture. Whether you are standing or sitting, how you stand while you communicate can literally change the message. Number three is your eye contact. If you do not establish the proper eye contact with the patient, they may or may not get the right message. In fact, they may get distracted. Number four is your proximity. The distance you have with the patient or patient's relative when you are doing that consultation. And number 5 is appearance. Because people are going to look at you before you even open your mouth. So these are the 5 elements of body language, 3 elements of voice modulation, and the effectiveness of the words which are important. Keep on working on all these 3, the words, voice and body language, because effective communication is an art where you can just become better and better and better with every experience and practice. Wonderful, right? So let's move to the second question. So Palak, what's the second question?
Dr. Parul has asked how to reduce overheads in dental practice.
Okay, reducing overheads. Wonderful. A very good question, but always a big challenge in dentistry. Isn't it? In fact, it's always a big challenge in every business profession in the world. Even if, no matter in which vocation you are, you would always like to have the minimum overheads and maybe the maximum output, financially and otherwise, right? But then, remember, now when it comes to overheads, in dental practice, there are 2 kinds of overheads or, expenses which you have. One is the fixed expenses and the second is the variable expenses. Now, which are the fixed expenses in your practice? You need to ask one simple question to yourself. Even if I do not get even a single patient in a month, or I do not earn even a single rupee, what is that which I will have to pay for? And that is the salary of your team members, right? Maybe the electricity bill, maybe the corporation or municipality tax or whatever, okay? And maybe any maintenance or any similar expenses for which you have no excuse, whether you make 100 rupees, 50 rupees or 200 rupees or 0, right? Whether you are in lockdown or not, okay? All the expenses which are must, which irrespective of your earning are going to be there. They are called overheads or fixed expenses. And the variable expenses are, they depends upon your your practice. Like for example, if you do more number of patients, you will consume more materials, more consumables and disposables. If you do more of the prosthetic work, you will find that your lab bill will go up. But if you do the less number of patients, all these expenses goes down. So these are called the variable expenses. Now coming back to the overheads. See, you should not try to, have the overheads at a very low or minimum, but you can always ensure one thing, that your overheads should not be too high. I'm sure in the COVID pandemic times, everybody realized those who had very high overheads were finding it very challenging to, manage those overheads in the COVID times. So you should not go for the minimum overheads, because if you really want to run your practice very professionally, there are certain expenses which you have to do. Okay, but then make sure that they are under control. I'll give you a simple example. Suppose you are a new practitioner. Okay, even if you have a single or two chair setup, you can have only one assistant, chairside assistant, and maybe one receptionist, and that's it. And unless you are having patients, it's like your chairs are occupied, your practice is occupied for 80-90% of the times. You do not need any other assistant. In the initial years of your practice, and if you want to reduce the number of overheads, the best thing to do is to work more. When you do more hard work, you can save on money, because you don't need that extra assistant, you don't need that extra dentist in your practice. Even if you have two chairs, you can very easily manage yourself on those two chairs. As your practice starts growing, I want you to ensure that you wait at least for 2-3 months before hiring more people in your team. Okay, because the practice can go up in one or a couple of months and then again come back to the average level. It should not happen. So when you are sure that your practice has reached a level where you need to expand your team, that is only then you should think of increasing the overheads. So it's not just about minimizing the overheads, it is all about managing the overheads. So I hope you understood the question, and I really liked answering this question, and this is how you go ahead. In the initial times, work hard, work more, and keep the overheads in control. Right? As you grow, once you understand that your practice has taken the, it's like take off now, or maybe the 5th gear now, then you slowly expand your team and your expenses, so that at any given point of time, it will not be a challenge for you to, spend that money and that expenses, that overheads. Right? So Palak, what's the next question?
Dr. Sunil Kumar has asked, how to overcome clinic location challenge if it's not visible?
Okay, so overcoming the clinic location challenge, and I'm sure not just Dr. Sunil Kumar, but this is a challenge for many practicing dentists. Okay, because not everybody can have the ideal location, ideal visibility, or accessibility to your practice. Okay, so no matter, and if I have read this question, because this was a big question by Dr. Sunil Kumar, and he said that one of my clinic do not have good visibility, and shall I start the clinic is okay in the day times. I remember that question, but in the evening, there are no shops which are open there, and the entire area is almost dark, and my clinic is not visible. So, or there is no crowd, no public in that particular area. So shall I start another clinic in the evening at some other location? So I'll tell you, Dr. Sunil Kumar, starting another clinic for the evening session just because you do not have visibility, honestly, is not the right approach. Because the moment you have the second clinic, you will have the second set of overheads over your head. And I think by the time that clinic settles down, and that too if that clinic settles down, you will have to spend double from your pocket. Second thing, you will always have this stress at the back of your mind that, this clinic is working well or not, and, I have one more clinic and it should work well. And it can take on, it can take a toll on your personal, physical or mental peace and, overall well-being. So I'm not saying you should not expand or go to the second clinic, but visibility or non-visibility should not be the right criteria. If you think your place is really not visible, no matter what, then you can think of changing location altogether and focus on one practice rather than having two practices. Okay? And other simplest way is to increase your online as well as offline marketing activities, so that people in your vicinity, in your area understand that there is a good dentist nearby. Okay, that's the simplest way. And I've created so many videos on how to do good online marketing, offline marketing, and a lot of stuff. There is a lot which you can learn from my YouTube channel. Okay, so do lot of good marketing activities, so that even if your practice is the only place which is open in the evening times in that particular area, people should come to you, and that's possible. It's not that it is impossible because 90% of the shops are closed. People do not go to that 10%. It's never like that. Okay. So you need to prove through your domain skills, through your soft skills, and through your marketing activities that you are a dentist who is worth visiting. So keep on working on yourself, your practice, as well as the marketing activities. And if you work on yourself, your practice, your marketing activities, trust me, your practice will be successful even at that place as well. Right? So all the best to you. Keep growing and keep practicing. Right? So now with this, this is time to choose the best question of the week, and I think Dr. Sunil Kumar's last question, I really liked answering that question. So that's the best question, or the today's question of the episode. So Dr. Sunil Kumar, congratulations! You're going to get the free copy of my international bestseller book, New Age Dentalpreneur. Right? Everybody else, subscribe to this YouTube channel and make sure that you do not miss any of the videos. And this is Dr. Sujit Pardeshi signing off from this episode. I'll see you in the next episode of Educhat with Dr. Sujit. Thank you.